Spring and summer just around the corner. Now is a great time to consider doing something about unsightly spider veins and more painful varicose veins. Dr. Roger Bonau is here now from the Vein Center to talk about some of the treatments for these problems. It's nice to have you with us.
Thank you. Nice to be here.
So let's talk about spider veins. For a lot of people that can cause embarrassment when you're thinking about wearing shorts or swimsuits or things like that. What causes spider veins?
Well, spider veins are just a smaller type of varicose veins, and almost all of them are caused by high areas of pressure, primarily because we walk upright. And the spider veins are usually dilated veins that are within the skin itself, so they're very visible, and they can cause locally some discomfort and itching, but most of the time they're considered cosmetic, and the treatment for it is pretty straightforward.
Pretty easy to treat with something called sclerotherapy. What's that?
So sclerotherapy is injecting the veins with a FDA-approved solution that makes them stop blood flow and then collapse and disappear. It usually doesn't happen immediately. It takes a little bit of time, and more often than not, you need more than one session to get the result that you want.
Okay. So that's a simple solution. Varicose veins, a little more complicated because it's a more serious condition.
Right. Well, varicose veins, or what we think of varicose veins, are usually the dilated, ropey veins that you usually see predominantly on the inside of the lower leg. And almost always when you get that condition, there is a deeper vein that you cannot see that's abnormal. And by abnormal, it means that instead of blood flow leaving the leg, blood is going down the leg. And that's what backs up and causes those veins to dilate. So the treatment for it is a little bit more involved because you got to take care of the underlying problem. In the old days, and by that I mean even 15 years ago, we used to actually strip the underlying veins. It was a surgical procedure, required time in the hospital. Now we do it in the office under local anesthesia, and instead of removing that vein, we use lasers to actually shut down the abnormal vein. Sometimes that's all we do. Oftentimes we wind up removing the varicose veins too at the same time.
But it's still an outpatient procedure.
It's an office procedure. It's not even in the hospital, so it's even less than an outpatient procedure. I would call it an office procedure.
So what's the outcome then?
Well, the outcome is excellent. Studies have shown that the results are actually more permanent than the old days when we used to physically remove that deeper vein. The laser is very effective. A lot of it has to do with your initial evaluation and workup. A comprehensive ultrasound is really key to tell you what exactly is causing those veins so you can treat them individually.
And this is a serious thing, so you really need to be talking to a board-certified vascular surgeon if you're treating a varicose vein.
Well, we think so. Now, traditionally we're always the ones that are taking care of veins, and I've taken care of patients in my entire 26 years of practice. What changed is that now you can do it in an office, and as a result you have non-vascular surgeons get involved in the treatment for it because it's no longer something that's done in the hospital. But I'd like to think that we have the most experience and the most knowledge of what exactly is going on with these patients. I think that we do the best job for it.
Is there anything you can do to prevent varicose veins?
Well, the traditional things about wearing support stockings and elevation and all of those things are not really super effective. The best things that we can do is maintain a healthy lifestyle, not be overweight, exercise, walk regularly. Prolonged sitting, prolonged standing are things that can cause breakdown of underlying veins, and that's why oftentimes the folks that we see more often than not are teachers and truck drivers and folks that are sitting down for extended periods of time. So it's not 100% preventable, but there are some things that you can do to lower your risk.
And fortunately, there are things you can do to fix it.
Correct.
All right. Thanks so much for being with us today.
You're welcome. Thanks for having us.
If you'd like to find out more, you can contact the Vein Center. They have 3 locations: Belmead, Cool Springs, and Mount Juliet. And you can also find out more online at veinreliever.com.